The strategic fund managed by PAHO is of vital importance to a small economy like Trinidad and Tobago. Because our economies are so small, our budgets are small, when we use the strategic fund through their pool resources, we get better prices. And so far to date, I think for the year we have bought over 1 million units of drugs, of items via the strategic fund. We buy a lot of our vaccines, and I'll tell you something. The flu vaccines that we buy through the strategic fund, Trinidad and Tobago has registered no deaths due to influenza for 2 consecutive years. First time since 2009. And that's because we have ramped up our purchase, and now we're bringing about 60 to 80,000 doses of flu vaccines. Other areas where the strategic fund has been of vital importance is our ARV, our antiretroviral drugs to treat HIV/AIDS. It has made an important difference to the achievement of our 90-90-90 goals, which we are to achieve by 2020. Some other drugs that we buy, important classes, oncology, anti-malaria, and anti-tuberculosis drugs. So we are very grateful to PAHO for having us use the strategic fund. So as far as our sustainable health agenda is concerned, Trinidad and Tobago since 2015 under this government has already included most of those objectives into our policies. For instance, we missed our MDG goals for 2015 in areas of maternal and infant mortality. I can tell you by policy intervention, we have reached our sustainable development goals in 2018, 12 years before schedule now for infant mortality and maternal mortality. That's a tremendous achievement for a country like Trinidad and Tobago. We have also introduced our non-communicable diseases plan, which we are financing through a loan through the Inter-American Development Bank. Some of the initiatives already taken are to tackle things like childhood obesity. We have banned the sale of sugar-sweetened drinks in schools. We are going to be going on an exercise program for schools and trying to introduce exercise into daily living. So our NCD plan is in full bloom. The other thing that we are doing now is our HIV, where we are committed to 90-90-90 to treat and test all, including migrant workers. So we may not accomplish every single thing under the SDG goals, but the main markers that will distinguish Trinidad and Tobago, we are well on our way to achieving those. And in the case of maternal and infant mortality, we have already achieved those. Well, communications for health has to do principally with changing behaviors. Behaviors not only population, but behaviors in physicians, pharmacists, and all the health workers, nurses, and everything. We want to do this with our antimicrobial resistance policy. We have to get that going. We want to do that with HIV/AIDS. We want to do it again with our flu vaccines. We use social marketing and social communications to get our messages across. So traditional media is now no longer the first platform. We have to get onto new media, Twitter, all those things, and social marketing is important.
Excellent. Now, just come here.